Good morning, everyone. I am Dr. Malea Jensen. Welcome to Dr. J's Prescription for Health. I am your host. This is my co-host. This is Tucker. Tucker is joining us today. So I have a co-host. I also have monitors and page monitors on YouTube and on Instagram. So if you see a blue wrench, that is them, and they are helping me with the moderation and with questions. So this is your opportunity, you guys, to ask questions and get them answered if I know the answer. All right, looks like we got quite a few people joining us on Instagram. Again, I am live on Instagram and Facebook. No, on Instagram and YouTube. I am not on Facebook at the moment. All right, who has questions? You know, I see Carrie on here, and I want to, it reminded me, I want to reiterate, when I ask for you guys or suggest that you guys get certain labs, maybe I'm not completely making it clear, or we are confused with terminology. And I don't want you to be confused with terminology, so I want to be perfectly succinct when I say to get certain labs. And what I mean by that is when I say blood glucose, that is your blood sugar level. It's your blood sugar at the moment that we check your blood. So if we get a fasting blood sugar at 8 a.m., that is in the fasted state for about 12 hours. That's what it should be. Hemoglobin A1C, or shortened to A1C, is a measure of glycated hemoglobin. Hemoglobin is a protein. Glycation involves binding of sugar to that protein. So a hemoglobin A1C, or shortened to A1C, is a measure of glycation. And doctors have used this to monitor or even diagnose diabetes. Hemoglobin A1C and blood sugar are not the same thing. Hemoglobin A1C and blood sugar and insulin are also not the same things. If I suggest that you get a fasting insulin level, it's a fasting insulin level. I suggest that whenever we check our labs for anything, make sure that you are checking those labs at the exact same time of the day. Every single time. So if you check it at 10 a.m. this time, the next time you check your labs, check it at 10 a.m. that next time. Also, the number of hours fasting needs to be consistent. If you fasted for 12 hours the first time, you need to do that each sequential time. Each time after that, 12 hours. Nothing more, nothing less. In fact, if you go over, it's going to skew the results. I have had people who fasted for 48 hours, sometimes 72 hours. They did a 3-day fast prior to getting their labs drawn. And they wonder why their cholesterol shot up. Cholesterol will shoot up. Your LDL could shoot up because our body needs cholesterol, and your body, when it doesn't have it coming in, will make it. So it could skew the results. Now, if you want to do a 72-hour fast every single time, then do that. I guess it's consistent. All right. So thank you, Carrie, for that overnight question, or I guess it wasn't overnight. You did it, I think, in the morning, and now it's already evening in your neck of the woods. So that was a good question. I didn't try to set you up. I just used your the fact that you came online. I wanted to remember to say that. It's the same thing when we check thyroid. If you guys are just checking your thyroid panel, it needs to be done at the exact same time. Okay, every single time of the day, the same time of the day, same amount of hours fasting. It has to be done consistently. Gamer says, guess what is lost 20 kilos in 3 months, but stopped routine for 2 months and gained 5 kilos. Okay, don't know what you're saying. Booty, hello, good morning. Well, it's good morning here. I am located in Iowa in the United States. So good morning, Jim and Deborah. Thank you for joining. I do not do live videos with anyone unless I have it planned. So if that was a mistake, that's fine. But if you're truly wanting to enter into my live video, then we need to plan for that. So I appreciate that. Okay. So come on, you guys, shoot your questions my way. Nothing so far. All right. I know this sounds basic. Yep. Thanks, Carrie. I appreciate it. This is very basic, but I want you guys to understand it. For those of you who might be new to my channel or just new to learning, this might be so darn simple to many of you, but I just want to explain the difference between type 1 diabetes and type 2. A type 1 diabetic has no ability at the moment to produce their own insulin. Insulin is made in the pancreas, of the beta cells of the pancreas. That's where insulin is produced. In a type 1 diabetic, it's an autoimmune disorder, and their body, their beta cells in the pancreas does not produce insulin. That is type 1. In order for a type 1 diabetic to live, they need to be given insulin. Exogenously means outside of their body. A type 2 diabetic has too much insulin. Type 2 diabetes is a disease of carbohydrate toxicity causing high insulinemia, high insulin in the blood. It is also insulin resistance because of the high insulin. That is the difference between type 1 needing insulin and type 2 having too much. So a type 2 diabetic, the treatment is not to give more insulin. The only reason you would give a type 2 insulin is if their beta cells have burned out. Is that possible? Maybe. I think we're still learning. I think in the days gone by, they would have told you, oh yeah, once your beta cells burn out, there's just no going back. I would disagree, because I've had patients who they're doing good on metformin, maybe a little bit of an SGLT2 like Jardiance, and then all of a sudden wheels are off the bus, blood sugars skyrocket, and you check their blood sugars and they're in the 300-400s, and you give them insulin. That is a knee-jerk reaction of doctors. They maxed out on their oral medications. The next thing to do is give insulin. Well, over time, I've had patients decrease the amount of carbohydrates that are in their diet. In fact, they go to 0 on some of them. They go to carnivore. And those carnivores end up not needing any more insulin. So were they ever insulin dependent? Probably not. If we would have checked a C-peptide back in the day, I would have seen that their pancreas was still working. And then they wouldn't have needed insulin. I would have needed to really buckle down on the fact that they need to change their diet, which I should have buckled down anyway. Is Alzheimer's a type 3 diabetes? I think Alzheimer's is a condition of insulin resistance. The brain needs fuel basically 24/7, okay? And it would move mountains to get its energy source. If glucose is surrounding brain cells and the glucose cannot get into the cells are resistant to taking in that sugar, in that glucose, okay? That brain is insulin resistant, just like any other cell in our body, like a fat cell becomes insulin resistant. You could give that brain ketones, even in the presence of the cells of the brain swimming in a pool of glucose, it will use those ketones for energy source. If a person doesn't have diabetes and they eat a carbohydrate meal and you take ketones, guess what the brain would prefer? Again, ketones. TJ says, good morning. A diabetic with a TSH of 8.9 and free T3, T4 normal levels. I don't know what normal levels are. The diabetes portion of it needs to be healed before you can heal your TSH, your thyroid. The TSH of 8.9, hypothyroid, should be showing you that if you were to get your diabetes into control or in remission, your thyroid would probably start, acting appropriately. But yeah, a TSH of 8.9 is not good. I imagine that person feels miserable, not only being a diabetic, but also being hypothyroid. Ross says, can we do pancreas transplant to cure diabetes? One, I don't know the exact answer to that, but I want you to think through something. Whenever we have a foreign substance in our body, that means your pancreas is not, if you take somebody else's pancreas, it's a foreign body in your body. And forever you will need to take some sort of an immunosuppressant because you will get antibodies against that pancreas. So over time, I don't know which is worse, your own type 1 diabetes or having somebody else's autoimmune disorder inside of me. I guess I would choose my own autoimmune disorder and forego getting a pancreas transplant. Justin asks, what's the deal with magnesium supplements, yay or nay? I would get a level first. So if your RBC magnesium indicates that it's low, then yeah, I would take it. If your RBC magnesium level is in an optimal range, no, I would not take it. Habanero, thank you for joining here. Let's see. Okay. Thyroid is a really interesting topic. Most doctors, I believe, only check a TSH, and I think that's doing you guys a disservice. We need to check a TSH, a free T3, a free T4, a reverse T3, a TG, and a TPO. I think all of these things are important at least one time, and maybe multiple times, especially if you're adjusting doses. There are so many things that can throw off our thyroid, including our diet, including the things in the air, including lack of iodine, including vitamins and minerals. All of these things can play a role in determining the function of our thyroid. I have talked in the past, maybe a couple weekends ago, about the interactions of vitamin A, vitamin D, copper, iron, and how they relate to thyroid function, how they relate to liver function. A liver that's not functioning well produces a thyroid that's not functioning well. Every organ that's a part of the body does not work independently. Yet we have independent subspecialties or specialties that treat just their area of expertise. So if you have a thyroid problem, you go to an endocrinologist. When in reality, the endocrine organs, the ones that produce hormones, relates to the cardiovascular system and the neurological system and the reproductive system. Yet we treat them independently. There was no such thing as specialties back in the day. A primary care physician, which there was only one kind, we call them primary care today. There was just doctor. Doctor did everything until, we got medications for everything. And so you need a subspecialty or a specialty for everything. So even under cardiology, you got interventional cardiologists, you got lipidologists, you got general cardiologists. Sometimes I think it's all a game. Peter says, how many drops of Lugol's 2% iodine for Hashimoto's? I don't necessarily think that iodine is the treatment for Hashimoto's. You need iodine in order to produce or to synthesize thyroid hormones. The thing with Hashimoto's is an inflammatory autoimmune disorder, okay? And you have inflammation for reasons that need to be looked into. But for the most part, I would say that a majority of people lack iodine because of our diet, because of our soil. It's just inevitable. Now, there are doctors out there who say you could take 50 drops of Lugol's iodine at 2% and be fine. It's water soluble, you'll urinate it out if you don't use it. There are others that err on the side of, do we really need that much? I don't know the answer to that. And is 4 or 5 drops plenty? Should you get an iodine level? Yes, you should. And then go from there. However, it's very difficult to get. And a lot of labs do not do it. So, yeah, those are the things that we need to take into consideration. So you would be safe taking 5 drops of Lugol's iodine. But again, I really think it's pertinent for you to get a level first. High stress, high cortisol, also bad for the thyroid. I would agree. Yep. The sympathetic nervous system in overdrive is really bad for all of our organs, not just our thyroid. Justin says, my A1C was 5.8 this past week. I fasted for 12 hours. I have some work to do. Is that 5.8 on a standard American diet? If it's on a standard American diet, yes, 5.8 is considered prediabetes. Is there a such thing as a prediabetes? No. You're either diabetic or you're not diabetic. We gave prediabetes so we could make more medicines for prediabetes. We give perimenopause a diagnosis because we can give more medicines to you for perimenopause. We have made up diagnoses in order to make up medications for them. Does that make sense? It's a game. My reasoning would be either get rid of your diabetes, through diet, improve your stress, to help a functioning thyroid. These are medications. I'm sure that there are, lovely times when we need to have medications. But when you can do it yourself and you rely on medications, I just can't get on board with that. I can't get on board with just supplementing for the fact of supplementing. Check your levels, you guys. Check your levels. Deep Waters says, when you eat organ meats and reduce general inflammation, thyroid begins to heal. Why is that, Deep Waters? What is in organ meat that helps the thyroid heal? What is it? Do you know the answer to that? Does it deal with vitamins and minerals? And which vitamins and minerals? You know? You're stating a correct, or making a correct assumption. I just want to know why. Is 11 too high for a calcium level? Yes, it needs to be looked into. I check everybody who's over a 10. If your calcium level is over 10, I start checking into it, and I will get I would get an intact, so a PTH, parathyroid hormone, intact. So I'd get an intact parathyroid hormone. I want to rule out a parathyroid tumor if I notice somebody who had a calcium level of 11. If the parathyroid tumor was ruled out, the parathyroid is fine. What is causing the bones and teeth to leach out calcium into the bloodstream? That's something else to look into. What do I think of berberine? Berberine is basically a weak form of metformin. Why do you need metformin? We need metformin for diabetes. Why would we treat with metformin or berberine when we could just get rid of what causes the diabetes? That would be a low or no carb diet to reverse the diabetes, because diabetes is toxicity of carbohydrates. So instead of adding berberine or metformin, why not just take away what's causing the problem? Okay. I'm reading through you guys' questions. TJ says, can you comment on the research that A1C cannot be relied on for anemic people or people with smaller red blood cells? Does the size really matter? I would venture to guess that the health of the liver is more. And do I really need research that an A1C cannot be relied on? No, an A1C cannot be relied on. There are many variables where the A1C cannot be relied on. Let me just give you one. If you are consuming a ton of fruit, are you eating fruit every single day? That's fructose. Does A1C measure fructose? The answer is no. The A1C measures glycated glucose. Will an A1C be accurate if you are consuming fructose? No. Could you have diabetes? Yes. In fact, fructose glycates up to 10 times faster than glucose. Glycation, sugar binding to a protein. A sugar binding to a protein. All right? Fructose can bind to a protein. Glucose can bind to a protein. Hemoglobin A1C does only measure glucose binding to a protein. In this case, the protein being hemoglobin. Now, your term anemic. Anemic tells the world that you have low hemoglobin? Or does it tell the world that you have low iron? What does anemia mean to you guys? Because I imagine that what you think it means is wrong. Anemia is dysregulation of iron. It's not in the right place at the right time. And so we are skewed into just looking at the hemoglobin and the hematocrit and saying, if it's low, you're anemic, here's your iron. When in reality, we need to know, where is the iron and is it working? Because you guys know from listening to me that iron is either heme iron or non-heme iron. Heme iron is about 30% absorbable, meaning we can use it. Non-heme iron is about 3% absorbed or usable. So iron is good, but when there's too much of it, it is not so good. You would not be able to live without iron. Unfortunately, our diets of either vegan, vegetarian, or high processed foods, or you being encouraged to take synthetic over-the-counter iron, have caused more of a problem than solved, because non-heme iron builds up in our system when we consume synthetic iron over the counter. That's non-heme iron. Whenever we eat when we eat processed foods, that is non-heme iron that's been fortified back into that processed food. We're consuming a ton of iron, more than we will ever need or use in our lifetime. And it causes damage in our body. Iron that is not usable is building up. It's in places where it does not need to be, where it cannot work, and it's causing oxidation. It's rusting your body. And I think that we need to dive in to the intricacies of how iron works in our body. But to come out and just say, hey, anemic people, one, you guys need to get the definition right first, because they're trying to bamboozle you. Anemia is buffoonery. Anemia does not mean necessarily low iron, because I have seen where people have low heme iron and high non-heme iron. They've got damage. And so we, as doctors, continue to give that person more non-heme synthetic iron. That's worsening their problem. We'll even give it to them via injections or IV. Now, if you're losing a lot of blood and you're going to die, my suggestion is to take the blood and take the iron, okay? But that is not the treatment on a regular basis, okay? Next, because people have smaller red blood cells, why does a person have smaller red blood cells? What is going on with the bone marrow that's producing smaller red blood cells? Microcytic, small cytic cells. What is going on? What's going on when we have macro, large cytic cells? We are unable to extract vitamins and minerals from our diet, from our body, and use them to make healthy red blood cells. What could possibly be going on with that? Could it be our diet? Could we be a vegan or vegetarian eating a whole bunch of plant foods with oxalates and phytates and tannins and saponins that actually block the absorption of iron? So it's just like the diabetic. You know what? It's just like the alcoholic. If we're going to treat alcoholism, do we just give them smaller doses of alcohol to treat their problem? If a person is diabetic and their disease is carbohydrate toxicity, do we treat them by just giving them small doses of carbohydrates? No. In both scenarios, the answer is no. That is not how you treat that. So if a person is high in non-heme iron and they're low in maybe heme iron because they've been told not to eat animal products, they have iron dysregulation. You don't treat iron dysregulation with more non-heme iron. You don't treat non-heme iron overload by telling people not to eat red meat and tell them to eat more plants, which plants have more non-heme iron in them. Plants have non-heme iron. Animals have heme iron. Is this making sense? Sizzle, thank you very much. Yeah, please, if this information is helping you, please hit the thumbs up. like, subscribe, pass it on to people who you think might, cherish the information. Geneva says, I have bad headaches from calcium level of 11. You need to go to your doctor and have it checked out. Is drinking 2 or 3, I'm guessing you said meant glasses, of whole milk daily okay for a 60-year-old? I don't know. How are your labs? Maybe consider a consultation. If you're feeling fine and you're 60 years old and you're not worried about diabetes or building up fat, then keep drinking your whole milk. There's a lot of sugar. But if you want to, there's not enough information in your question. I wish I could help. Oren says, I have severe psoriasis. Psoriasis is a rash on the skin. It's usually plaque forming. I can't seem to heal it. Tried the GAPS diet, then elimination diet. I don't know what elimination diet is for you. An elimination diet for me would be meat, ruminant meat, salt, and water. And I'm guessing the psoriasis would be gone. But psoriasis is an inflammatory condition, and it's usually triggered by insulin resistance. And, of course, iron overload. So taking vitamin D, don't do that. Vitamin D is going to lower vitamin A, and vitamin A is going to decrease the production, really the use of of copper. And then copper is going to cause or drive iron into the liver. Not a good thing. I don't think you need vitamin D. If you think you need vitamin D, get an active vitamin D level and get an inactive vitamin D level. And the active to inactive vitamin D level should be 2 to 1. You're taking EPA in the form of what? Why are you taking berberine? Do you have diabetes? Do you need to lower your blood sugars and that's why you're taking berberine? How about not eat the blood sugar or eat the sugar that raises the blood sugar? That's just my thoughts. Linda, I don't eat swordfish, so if you do, tell us how you cook the swordfish. Kai says, should we be eating more meat than veggies? Well, what is the benefit of eating a veggie? What is the benefit of eating a meat? Meat is the most nutritionally dense food that you could possibly eat. Veggies have no nutritional value. They're a carbohydrate. In fact, they have more anti-nutrients than they have nutrients. So if somebody says, but I do it for my vitamin C, well, you're not going to be absorbing the vitamin C because you're eating the vegetable full of phytates and oxalates. So Kai says, what are my thoughts on a carnivore diet? I like it. Oren says, I don't eat sugar, wheat, gluten, dairy, or nightshades. So, Oren, you are only eating. So, let us know. To get back to TJ's question about the red blood cells, I think it's important to know also that hemoglobin A1C is a measure of glycated glucose, but it's also dependent on the lifespan of a red blood cell. Meaning, if a red blood cell lasts an average of 120 days, and your red blood cells are lasting about 120 days, the A1C could be fairly accurate, okay? But if your red blood cells are lasting longer than 120 days, so they're living longer, the A1C, hemoglobin A1C, could be elevated, falsely elevated. If your red blood cells are not healthy and they're dying off faster than expected, then your A1C will be falsely low. You could get a reticulocyte count. You'd have to have your doctor order it. It's not on any standard blood test. You would have to order separately a reticulocyte count. A reticulocyte count are basically baby red blood cells being produced from the bone marrow. If that reticulocyte count is high, elevated, then that tells me that you have cells that are dying off faster, and the bone marrow is trying to spit out a bunch of baby progenitor red blood cells in order to keep up. So getting a reticulocyte count can be give a lot of information. Kai says, I hopped on late. Are the concerns with heart issues with a carnivore diet true? What are those concerns? And I can speak to those. I don't know what what the concerns are that you're reading, so I can't speak to are the concerns. What are the concerns? TJ, I don't know why it's pausing either, but just, hang with me here, and it usually stops back or comes back on. Good morning, Lion. Good morning, Lucy. Staying hydrated and happy. Good. How's the weather in California? Because the weather in Iowa is cold and snowy. Lucy says, I'm recouping from kidney damage caused by chemo. Their GFR is 22. That is stage 4. Is that stage 4? I'd have to look up the numbers, but I believe that's stage 4 chronic kidney disease. But I'm guessing this is an acute kidney injury, and hopefully, Lucy, that will, pop back, okay? I want to be a carnivore again. So what is stopping you? Maybe start with very small portions of meat. Your thoughts? Well, what else are you eating, Lucy? As opposed to if you don't eat meat, you're going to eat carbohydrates. Is that correct? And what does sugar do to the kidneys? Not very good things, right, Lucy? So I'm not sure. I'm just using common sense here. Kai says the concerns are leading to heart attacks, and heart attacks high cholesterol. So could a carnivore diet increase cholesterol? Sure, but is that a reason to be concerned? And how do you measure cholesterol? Okay, if it's raising cholesterol, how are they actually measuring cholesterol? Because cholesterol you cannot measure in the bloodstream. You measure cholesterol inside of lipoproteins. A LDL, low-dense lipoprotein, carries cholesterol. High-dense HDL, high-dense lipoprotein, carries cholesterol. A VLDL, very low-dense lipoprotein, carries cholesterol. So what is it, Kai, about high cholesterol that is concerning you, and you think simply measuring cholesterol is going to cause a heart attack, when likely most common cause of a heart attack is the repercussions of diabetes? So I would guess that, or I would speculate or lean more toward checking and making sure I don't have diabetes, because that's the number one cause of heart disease. Cholesterol is way down on the list, if it's on the list at all. Oren says, say you eat lean proteins, chicken, turkey, lamb, salmon, whitefish, lots of low reactivity vegetables, broccoli. If you're a man, Oren, I would probably stay away from cruciferous vegetables and estrogenic things. And spinach is full of oxalates, so I guess you're good with not absorbing whatever you're eating for nutrients, like all that protein you mentioned. Guess what spinach is doing? It's decreasing the absorption of your amino acids and your B vitamins and your iron. and zinc and selenium and calcium and magnesium. So if you, Oren, choose to eat the vegetables, I go for it. The sweet potato that grows in the ground, and inside the ground, we have a ton of heavy metals, and sweet potatoes grow under the ground, right? They're not above ground. So they have more chance of soaking in all of the heavy metals that they're nurturing in. Fruits like berries and apples, again, what is the nutritional value of eating any of that you mentioned? And why are you only eating lean proteins? Why are you only choosing chicken and turkey, which are high in lectins? Lamb is the only good thing on there. Salmon grows in, hopefully, the ocean and not a farm, and it's full of heavy metals as well. I think we've been skewed by propaganda. We've been bamboozled by the buffoonery is what I'm trying to say. But again, if you feel good on this particular diet, you're asking my opinion. I'm giving you my opinion. And, you know, if you choose and you feel great on these things and you don't have diabetes and you don't have any inflammation and you don't have rashes and you don't have joint aches and pains, then you're skipping down the street singing the happy song, Oren, by all means, continue your diet. No one should tell you otherwise. But nuts, legumes, and vegetables, not high-starch foods. I love meat, but I needs some vegetables every once in a while. What do you needs them for? You needs them for your flesh because you have lust of the eyes, lust of the flesh, and the pride of life. You just needs them. That is up to you if you needs them. That doesn't mean we need them to survive. Gary says, how does berberine affect the kidneys? I would say, I don't know the exact mechanism of how the plant works, but if it works like metformin in lowering blood sugar, that's a positive aspect on the kidneys, but I do not know the exact plant effect on our kidneys. Pears, bananas, gluten-free carbs such as quinoa, brown rice, healthy fats like olive oil, avocado, coconut, while avoiding dairy, gluten, soy, corn, sugar, alcohol, seed oils. Okay. Your brown rice doesn't have any seed oils in it? Quinoa, have you checked the boxes? A lot of lectins in there. Bananas, full of full of sugar, raised triglycerides. Pears, full of sugar. No nutritional value. Those are the things that are causing your psoriasis, and you wonder why you can't get rid of it. Elimination diet of ruminant meat, salt, and water. 30 days. And let us know how your psoriasis is doing. Main House says, all we eat is grilled hamburger, meat, and pork loin, green beans, potatoes as our weekly diet, and fast food breakfast sandwiches, eggs, bacon, bun. Is that on the weekends? Is that what you mean? So you were talking about your weekly, or you just eat all of that stuff? Is that good for you, or how are you doing with that? How healthy is that? Well, you tell me how healthy it is. Tell us about your health. I don't know about your health, but if you would love to consult with me or like to consult with me, you can email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Lucy says, no sugar, eating homemade veggie soups, that's sugar. Home-laid eggs, good. Cheese, there's a little bit of sugar in cheese. Bread has sugar. Ice cream has sugar. Doctor says, hopefully kidneys will bounce back now without chemo. So your doctor is hoping that your kidneys bounce back by telling you to eat sugar? You just said you're not eating sugar, Lucy, but he prescribed you to eat sugar. Some veggie soups, cheese, and bread, as well as some ice cream. And the doctor says these are okay? I don't know about that, Lucy. Diabetes is the most common cause of kidney failure. Diabetes is carbohydrate toxicity. Broccoli sprouts. Again, why are you eating the sprouts? Main House is also doing a lot of vitamin supplements. Why? You think that you are on supplements? Well, maybe it's because you eat non-nutritious diet, so you need a lot of vitamin supplements. That's probably what's going on, Main House. Kai says, my labs, HDL and LDL, doctor states for me to eat less red meat because and increase of my cholesterol. I have no diabetes and all other labs are fine. Well, Kai, you might have been told that all of your other labs are fine, but I haven't looked at them, so I can't agree that all your labs are fine. In fact, I bet I could find something that is not fine on your labs. And so if you choose to eat less red meat or no red meat, that is up to you. I would think that you need heme iron, but maybe you don't and everybody else does. Maybe your doctor doesn't need any heme iron and everybody else does. Why do vegans look unstable like they're fragile? I don't know. Could it be because they have no nutritional value and they're malnourished? I mean, it's possible, right? Let's see. Oren says, I eat only organic. Good job. Oren asks, what would you eat to clear psoriasis? For those of you listening, he might have or she might have lost contact, but I said try an elimination diet of ruminant meat, salt, and water. Ruminant meats are cow, bison, buffalo, sheep, lamb, deer. Okay. Simply Red says, I'm in perimenopause. Everybody's in perimenopause until they're menopausal. So that means a 13-year-old is in perimenopause. That's a diagnosis that was made up. I don't want to get on Ozempic. Why would being perimenopause need you or require you to get on Ozempic? I have lupus. It's an autoimmune disorder. So why do you have an autoimmune disorder? I can't lose the last 15 pounds. Help. Only in gut. What is your question, Simply Red? Rich says, what is the basis for avoiding dairy? I think some people can't tolerate it. They might not be able to tolerate lactose, which most of us can't after the age of 5. We also may not be able to tolerate the casein or the whey proteins of dairy, casein being more so. Casein has casomorphines and they're very addictive. So people find out that, hey, I got to avoid dairy or else I'll eat too much and get fat. Main House says, my blood work is good. Again, that's your opinion of what good is or some other doctor's opinion of good. It might not be my opinion of good, but you have COPD as well. Okay. Let's see. 1910, good morning to you as well. Let's see. Chat with Lucy says, doctor will not commit to any recommendations regarding foods. You are so correct. I'm eating sugar. That's it. Carnivores as of today. Getting ready for church. We'll pray. Happier today. Thank you, doctor. You're very welcome, Lucy. Remember, your disease, your kidneys are touch and go right now. They're very sensitive to anything that you put in your body. So you don't want to overeat, you don't want to undereat, you don't want to drink too much water because it's going to encourage the kidneys to concentrate even more. So if you're drinking too much water, you're actually burdening your kidneys because they're having to work extra hard to concentrate your urine. That is not good for your kidneys. Oren says, what is ruminant meat? It is animals that have multi-chambered stomachs, like cow, sheep, lamb, bison, buffalo, deer. Those are ruminant animals that have ruminant meat. Gary says, my A1C is 6.01. What do you think my diet should be? I don't know without knowing more of your labs. So if you would like to consult with me, you can email me at IronLadyDoc@AOL.com. IronLadyDoc@AOL.com. Yeah, Kai says, oh, they did say I was anemic. Well, what is the definition of anemia, right? That's the we got to get down to brass tacks right there. The definition of anemia does not necessarily mean low iron. It's iron dysregulation. You have a problem regulating your iron. It might all be there. It's just in all the wrong places. Main House says, thank you. Love the knowledge. I will be emailing you. Thank you. You're very welcome. Hopefully I helped. Oh, what do I charge for consultations? It's $110 an hour, whether you're in the U.S. or not in the U.S. I take credit cards. Okay. What else do you guys got? Oh, what do consultations in, what do I do during a consultation? I'm hopefully that you would send me your labs and then we will go over your labs together. We also go over your medical history. We go over your medications, your allergies. We go over your diet. We go over exercise routine. We talk about your sleep. We talk about all the things that you probably do or do not do with your own primary care provider. And then the information you glean from a consultation, it arms you with information so you can take that back to your doctor, your primary care doctor, because I'm not your doctor. This is not medical advice. This is for information purposes only, general wellness, okay? If it's general wellness, then you can take that information back to your doctor and discuss it. Hopefully they will schedule in some extra time with you so you can go over things. In the winter with little bit of sun, how much vitamin D K2 is recommended? Again, I would definitely get an active vitamin D level as well as a stored vitamin D level. In all reality, if your levels are in the good range, your active vitamin D should be around 45, and your stored vitamin D should be around 21, 22. That ratio is about a 2-to-1 ratio, and that's where it should be. And then I would not suggest you taking any more D3. Okay. Abby says, Jesus is my doctor. I agree. And he's the best doctor for sure. Yes, Oren, if you email me the labs, I can look at them during our consultation. Lucy says, I'm drinking lots of water. Lots. Geez, so happy I tuned in today. I feel better already. Yeah, we don't want to overhydrate, Lucy. We should just be drinking when we're thirsty. Do not overdo it. That's very hard on your kidneys, okay? Arizona Nana, good question. She's asking, before a consultation, What blood test do you recommend getting? Arizona Nana, if you email me at IronLadyDoc@AOL.com, I will send you a list of pertinent labs that I like to look at for everyone's consultation. So if anybody wants to email me and ask, and I've had this, it's free. I'm not going to charge you to send you an email back with labs that hopefully you'll be able to ask your doctor to obtain. If your doctor will not get your labs and you're in the United States, minus about 5 or 7 states that I cannot order your labs in, but I would be happy to order your labs as well. The caveat is insurance will not pay for them, but you could use your HSA money for those labs. I don't know all the intricacies, but yeah, Nana, if you want to email me, I will definitely send you a list. So IronLadyDoc@AOL.com. Geneva, with your albumin and your calcium elevated, other labs need to be looked into, okay? You need to talk to your primary care provider in that. Abby says, I'm Black, person in Minnesota. Yeah, that's unfortunate. Hopefully, I mean, it is possible that when you were out in the sun, you stored enough vitamin D. But again, even though you're Black and you're in Minnesota where it's very, very cold, there's still sun. All you need is actually for it to go into your eyes and on your skin of your face. You don't need complete body absorption. So you could still get enough production of natural vitamin D through your eyes and your skin of your face. So I would still do that. I would not wear sunglasses. But in all reality, Abby, I would definitely get your levels checked, because you might be thinking, oh, I'm just Black and I live in Minnesota, I'm never outside in the winter, I should just take vitamin D, when you might not need it, okay? You might not need it at all. Is there a diet, an anti-inflammatory diet that helps reduce chronic pain? Yes, it's called an elimination diet, and it includes ruminant meat, salt, and water. Try it and see if your inflammation goes down. Oh, Rich, that's a good question. What is my opinion on creatine? I go back and forth. This is what I truly want to believe, okay? I want to believe that the amount of red meat, or meat in general, but mainly red meat, that I am consuming will give me enough creatine that I do not need to supplement. And I take that to heart, okay? Could I absolutely be wrong? Yes. Studies that they are doing on creatine, the dosing becomes higher and higher and higher. Right now, they're doing studies on 15 milligrams as it relates to neurological conditions, so like cognitive impairment. I don't know if our creatine supplements are actually creatine. I don't know if there's a bunch of microplastics in them. I don't know. And so if, go ask the garbage man and see what their opinion is. Being a doctor, I still don't know. But my opinion, I'm hoping I'm getting enough in my meat. That is what I can say. It's hard. You can't really measure it. It's just difficult. And that's why I'm not huge on supplements in general. I just think that if we ate a nutritionally dense diet of, animal-based diet, I think we're going to get everything we need. And add to that, if we make sure it's organic and pasture-raised or grass-fed, then our chances of having good essential fatty acids, and that's important. We need essential fatty acids in order to survive. We need essential amino acids in order to survive. There are no essential carbohydrates. And, I'm under the belief that by putting these carbs, even if they're vegetables, they're just decreasing my absorption of the things I really want. So I always joke around that if I'm going to eat a $25 ribeye steak, I'm not going to put vegetables beside it because they'll make my $25 ribeye steak to a $5 ribeye steak because I won't absorb it. It might taste great, but I don't eat just for taste. I eat because I want to be nourished. And that's why I'm hoping that my meat will have enough creatine in it. Okay? O says, can eggs, so, okay, Ohio says, can eggs replace some of the meat consumed? Eggs are 100% bioavailable. Eggs are, again, probably, they're so nutritionally dense. It's just that some people react to eggs. And if you're okay with the reaction to eggs, it's fine. Chicken eggs have reactions in some people. You could switch to a different egg, like goose egg or duck egg or any other types of eggs, and maybe not have as much reaction. But if you're finding that you're having gut disturbances when you eat eggs, or I had one guy tell me that he was urinating in the middle of the night, so he would have to get up to urinate, and he narrowed it down to eggs in his evening meal. So when he went off of eggs in his evening or late afternoon meal, oh, there you are, RM. I was wondering where you were at. Thank you for being here. I really do appreciate you. Thanks for being here. That he's my moderator, or she, I don't know. But RM is got a blue wrench and they are the moderators. So good afternoon. Must be afternoon there. It's still morning in Iowa. It's 11 a.m. here. Hi, Tracy. Nice to have you here. So Ohio, if eating eggs for you works, absolutely do it. I would get pasture-raised eggs, organic pasture-raised eggs. So whatever, hopefully the chickens are eating really, really good food. I have a neighbor that has duck eggs. I love them. Virginia says, good morning, Doc. 125 days on carnivore, keto, mostly carnivore, just meat and butter on carnivore. Virginia, hobby. I think that we should consider thinking about adding in some organ meats, okay? Maybe just a little bit of liver once or twice a week, or some hearts, or spleen, or intestines, or something once or twice a week, okay? You can get liver pate, you can get all kinds of liver, okay? I also like to add in sardines a couple days a week. So I like to get my vitamin A and vitamin D, as well as the good omegas from the sardines. Wish Wash Repeat says, I love duck eggs too. You know, once you've had chicken eggs and then you switch to duck eggs, the way I could explain a duck egg as compared to a chicken egg in terms of taste, because the size is obvious, but in terms of taste, duck eggs seem creamier to me. I don't know if that's the right word, but they just seem richer or more delightful than a chicken egg. I love chicken eggs, but I really like duck eggs. Jean says, I couldn't eat eggs at all while I was pregnant. I didn't take any Tylenol and had an autistic son. I have ADHD, which shares the same genes as autistic people. Okay. RM says, I was in class. I am preparing to be a certified phlebotomy technician, so I have class 9 to 12 on Saturday and Sunday for 5 weeks, then break. Yay! Nice. You're going to be, you know what? You're going to find yourself looking at everybody's veins and saying, ooh, that's a good one. I could draw out of that one. I remember when my nurse started drawing labs, she'd be looking at everybody's veins and going, those are nice. And when you're a bodybuilder, people would say that yes, vascularity, we called it, but I remember the guys and girls at the gym would call them worms. When the worms start showing in your abs and on your back and in your arms, those are the veins. And that was a good sign that you're getting lean. Geneva says, is butter from grass-fed cows okay? It's the best. You want your butter from grass-fed organic cows. Katia says, doctor, how to replace statins? Sorry for the typo. Phone is small. No worries. How to replace statins? Why are you on a statin? Do you know the reason why you're on a statin? Geneva says, I really love this channel. I wish you were my doctor. I'm actually nobody's doctor at the moment. I only do online consultations right now, and I'm loving it. You guys are awesome. You really are. It's been a wonderful transition from private office work to private home office consultation work. No, I don't get to lay hands on, listen to hearts, and do those things anymore. Look in your ears, tell you got wax in there, tell you how to get it out. I don't look at throats anymore. And yeah, I miss all those things. I miss making sure that you don't have an enlarged liver, but I learned to do things differently now. And my passion is to help you live longer and with higher quality of life, if you want to. That's why you would come to me. If people don't come to me, I know that they don't want to, or they found somebody else like me and it helps them. I'm not the only one out there, and I'm definitely not the smartest one out there, but I will work with my clients, and we look stuff up together and we talk about it from a logistics. We might not have the answer, but boy, do we talk and hash it out, and that's like shared decision making. And I think that's really important. When we start treating our doctor like from a paternalistic view, or even from just information purposes only, which I'm kind of giving right now, I'm basically like vomiting out information to you, okay? And then I'm asking you to use that information and make good decisions. But if you were in a consult, it's more of the shared decision making. Like we talk it over and say your calcium level is 10.5. And I say, hey, do you think that we should consider maybe getting an intact parathyroid hormone level and see if, hey, we don't have something going on in our pituitary that's causing the elevated calcium level, which is the calcium is high because now it's sucked it out of the bones and teeth, and now you're going to get osteoporosis. So we walk through all of these things and we talk it out, and it helps you make better decisions. Now, not everybody does a consultation, and you love just the vomiting of information and make do with that. Carrie says, but you know fitness like the back of your hand, which is also gold from a doctor. True, I was into fitness before I was a doctor, so I have a lot of experience when it comes to fitness. I have a lot of experience when it comes to being a doctor. I've learned things a lot the wrong way, and I'm trying to make amends for that, and I'm changing a lot of things, and changing from being in an office to being completely online has been a transition. It's been difficult, but it's been beautiful too. Jean says the NIH and the CDC states that autism is caused by one parent who has ADHD, autoimmune disease, environmental allergens. Autism is 90% genetic. Okay, thanks, Jean. Oren says, what's your view on histamine? I was wondering if my leaky gut and inflammatory markers are connected to histamine that's causing the psoriasis. But why do you have histamine? Why are your mast cells producing histamine? Okay, so we're gonna skip that one. Okay. Wishwash says, is there any dietary way to address the dismal effects of estrogen depletion in order to reduce the chance of breast cancer recurrence? One, do not eat estrogenic plants, phytoestrogens. Don't take phytoestrogens. Is there a dietary way? Yes, eating animal fats. If you eat animal fats with saturated fat and cholesterol, that leads to the production of pregnenolone. Pregnenolone can make progesterone, and pregnenolone can trigger the healthy adrenal gland to make DHEA. And DHEA converts to androstenedione, and androstenedione aromatizes to testosterone, converts to testosterone, and testosterone aromatizes to estrogens. So a healthy way to make estrogens is to eat animal cholesterol. We are animals and we have cholesterol, and animals have cholesterol. We should eat animals. We don't eat or take in plant sterols, which is their cholesterol. Plant sterols are not like our cholesterol, animal cholesterol. Linda says, do you have a set schedule on YouTube? I do. Every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. Every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. I also do reels in between there. 3 or 4 times a week, I will do those. Geneva says, good docs are hard to find in my opinion. I would agree. I haven't seen too many in my lifetime. Sweet Tooth, ma'am, how do I overcome PCOS? Let's define PCOS, polycystic ovarian syndrome. Usually includes hair growth, male pattern hair growth, so androgen side effects. It also is the biggest cause of infertility in females. So this particular female, that could be the reason for your PCOS. Had it for 13 years. I don't want to have the monthly pills, so your doctor is going to give you some sort of estrogen pills because you are not converting your testosterone to estrogen yourself, so they're just going to give you some estrogen instead of telling you that your PCOS is due to hyperinsulinemia, high insulin in your blood. High insulin in your blood is the result of eating carbohydrates. So you're basically a diabetic. So Sweet Tooth, are you a diabetic, Sweet Tooth? And so if you want to overcome your PCOS and not take estrogens, so if you want to know the process of every estrogen for a female was once an androgen. And if you, Sweet Tooth, have an inability to aromatize your testosterone, which everybody has, male and female, you females convert testosterone to estrogen. If there is a block in that sequence of converting testosterone to estrogen, that is due to high insulin. The only way to lower insulin is to not eat carbs or not eat at all. So how do you overcome PCOS? Don't eat carbs and fast. But I would not fast before I lowered my carbs and got my insulin level down, because if you have high insulin and you just started fasting, when you end that fast, you are going to be famished and you will overeat, you'll feel guilty, feel shameful, and you'll do the whole cycle over again. So how do you lower insulin in your body? You lower it by stop eating carbohydrates. Truth Seeker says, hi, Dr. J. Wondering if you suffered any ill effects from extreme bodybuilding. Yes, my joints suck. My fat pads in my face, you guys have mentioned those before, are gone. So extreme dieting can have a lot of effects, but those are the two biggest ones. Kai says, this is the first time on your channel. Thank you. This is great. I appreciate you. I appreciate you for being here, Kai. And hopefully I'm helping. Linda says, I'm listening and thought the phlebotomy student was studying lobotomy. Well, maybe that's a good thing too. But yeah, RM is our moderator and studying phlebotomy. Linda says, thank you, Doc. We appreciate you. You're very welcome. Kai says, I've been on allergy shots for 4.5 years due to environmental allergens. Why? Allergies to hazelnuts, to shrimp, to everything. You're allergic to everything. Is it possible, I'm just throwing it out there, that we have so much glyphosate in everything that it is causing problems with allergies and making you hyper allergic? So now you're taking allergy shots, which basically they're giving you the allergen, so you'll build up more antibodies to it. Maybe consider avoiding as much glyphosate as possible, and that starts with getting rid of plants. Good morning, Anne. Sweet Tooth says, with regards to PCOS, I do not have diabetes. Are you sure you don't have diabetes? How do you know you don't have diabetes? Are you just looking at your A1C? Because if you are, I would venture to guess that you're wrong, or you've been bamboozled and told that you do not have diabetes when you actually do, because all PCOSs have hyperinsulinemia, and hyperinsulinemia is diabetes. Kai says, looking forward to booking a consultation with you. Thank you very much. Geneva says, I sent my PCP an email. I hope they respond. They will likely respond. I don't know that doctors won't respond. They might not respond in the manner that you want them to respond in, though. And you have to prepare yourself for that. I don't know what you emailed, but okay. Floored for the Lord says, is there some way I can contact you? If you are wanting to sign up for a consultation, you can email me at IronLadyDoc@AOL.com. Ohio, can hyperinsulinemia cause shakes in the hands and knees? I don't know the definition of your shakes, but if you have high insulin will drive down blood sugars, causing very low blood sugars, where it could cause the shakes and feel like hypoglycemia. Then you go and eat sugar, which raises the insulin even more. That is not a good rat race wheel to be on. You really need to get that insulin levels down by lowering your carbohydrates. What is the test to get for hyperinsulinemia? It's called an insulin level, a fasting insulin level. I only get A1C and glucose ordered by my doctor. So you're gonna have to ask for a fasting insulin level. A fasting blood insulin level is what you want to get. So thank you, RM. Sweet Tooth says, my blood sugar is on the lower side. Exactly, because your insulin is too high. Your insulin is driving your blood sugars down. So I don't know what the lower side is. If it's 70 or 80, that is normal. If it's 90 or 100, you have hyperinsulinemia. Right. Yep, RM, that's exactly right. If you want to schedule a consult, thank you. Yep, email me at ironladydoc@aol.com, not email.com. So AOL. Stephanie says, so happy to find you, and I can't wait to meet you. You'll be hearing from me. Nice, thank you. Linda says, did healthcare plummet when doctors stopped doing probably house calls? I don't know. I've never done house calls. I mean, when we were residents, we did house calls, but it was mainly for, maybe, I don't want to say underprivileged, but the people who couldn't get to the doctor. So that's when we did house calls. RM says, how is hyperinsulinemia fixed? High insulinemia in the blood is fixed by lowering your carbs. Christine says, I have a consult with 4 gynecologists. Good. Chris says, should I renew hormones? 44 years old. What do you mean renew hormones? All right. Am I missing any questions, you guys? You know, while we were talking about the PCOS thing, I want to make reference to, because we're talking about hyperinsulinemia a lot. Insulin resistance is high insulin, and it's insulin resistance. And I know you go, Dr. Jensen, that's kind of circular logic. But in order to be insulin resistant, you have to be insulin resistant and have high insulin. Insulin resistance and metabolic syndrome are one and the same, okay? Insulin resistance syndrome used to be the name for the current metabolic syndrome. In fact, when I was just getting out into medicine and practicing, it was called Syndrome X. And Syndrome X was high blood sugar, high blood pressure, high triglycerides, high waist size. So 4 highs and 1 low HDL. That is metabolic syndrome. Metabolic syndrome is a huge risk factor for coronary artery disease. Nowhere in metabolic syndrome did I mention LDL, did I? Nowhere did I mention ApoB or HDL. I mentioned triglycerides. I did mention HDL, excuse me. Did I mention LDL? No. LP(a)? No. VLDL? I did not, but I mentioned triglycerides. If we are looking at the number 1 cause, and they're now calling it metabolic cardiovascular syndrome now, they're actually admitting to you that the cause of coronary artery disease or cardiovascular disease is metabolic. So in a way, they're probably going to move the goalposts on the LDL and say, you know what, we were kind of wrong, but I'm just going to distract you with all of this metabolic stuff. And so we got another medicine for that. In fact, the medicines that we got, we're just going to get the approvals for. So if you guys want to be on a GLP, now it's good for your heart. It'll actually help with your COPD now. It'll help with your sleep apnea. It'll help with your kidneys. All of these indications. Just take a GLP. Why not just stop the food that you're needing the GLP for? That's just, I mean, that sounds really, really simple. So, metabolic syndrome is, I believe, the number 1 cause of cardiovascular disease. Okay? That has nothing. Did I mention anything about red meat? No. Lucy's off to church. God bless Lucy. Let's see. Truth Seeker says, can you touch on sarcopenia, muscle wasting, especially in those taking metformin? Yeah, metformin and exercise do not mix. And then the reason being is because metformin actually is toxic to mitochondria. And mitochondria are necessary to produce energy for everything, including muscle cells. So is metformin toxic to our mitochondria and it actually causes muscle destruction, sarcopenia? Yes. Is it, I don't know if it's listed in the package insert that, hey, if you take metformin, you're going to get muscle wasting. You're going to get loss of lean muscle mass. I doubt it says that. I don't know. I'm just speculating. But yeah, it has to do with the toxicity to the mitochondria. If you're taking metformin, why are you taking metformin is my question. If you need metformin for diabetes, then I would get rid of the diabetes so you can get rid of the metformin. Did I miss your answer regarding statins due to cholesterol? No, you did not miss my answer. I had a question back to you. Why is your cholesterol a problem? How are you measuring your cholesterol? And why do you need statins? Linda says, after a hysterectomy, do women need estrogen replacement? Well, not if they're just doing a hysterectomy. If they're just taking your uterus out, you shouldn't need estrogen replacement. If you're having a total hysterectomy that includes the uterus, the ovaries, and the fallopian tubes removed, then you have to decide whether or not you're going to do estrogen replacement. The fact that you had your ovaries removed doesn't mean you can't make estrogen. If you have fat on your body, Linda, you have fat stores of estrogen. If you eat saturated fat and cholesterol, your adrenal glands will take over 85% of your estrogen production and make enough estrogen. So the answer, in my opinion, do women need estrogen replacement? No, unless, of course, they don't want to follow through on the recommendations to get rid of their insulin resistance. If you have insulin resistance, there is no way that you're going to be able to make your own estrogen. If we cannot, RM says, if we cannot tolerate Ozempic, can we tolerate Mounjaro? There's a good chance you can, but everybody's different. So if you're on Ozempic and you are not tolerating it, then a lot of doctors will switch their patients to Mounjaro and have great success. Should milk be stopped in PCOS cases? I think anything with sugar in it should be stopped in PCOS cases. Anne says sarcopenia is different than cachexia, question mark. Cachexia is the whole body wasting away. Sarcopenia is muscle wasting. We use that term interchangeably, like when we're doing hospital rounds and we'll describe a person lying in the bed and we'll put cachectic 70-year-old male lying in bed, alert and oriented. Cachectic means low weight. You know, that's the word we used. We didn't say we have a 75-year-old male with sarcopenia. No, we never use that word. That is basically a newer word. Siderath says mitochondria are the powerhouse of the cell. They sure are. They do a lot besides that. I'm family practice. Charles says, if an ESR is greater than 120, is it life-threatening? Is the person still alive? I don't know. I don't know the ranges on the SED rate. I'm guessing that's high, but why? Why is the SED rate high? What is the CRP? What is IL-6? You know, there's other inflammatory markers that I would be Linda says, you're such a blessing. I understand your explanation. Good. Does drinking from a copper carafe help build copper stores in the body. Well, I think there probably is some copper leached out of cups and carafes like that. I don't know how much, but you can get an RBC copper level and see where your levels are. That's what I would do. I would get RBC at least 1 or 2 times, if you're monitoring things, get an RBC zinc level, RBC copper level, get an active vitamin D level, get a stored vitamin D level, and get an RBC vitamin A level. I would get those RBC levels. They're more specific and they're more accurate. Ohio says, this is the kind of information conversation that I want to have with my doctor, but never happens. I'm sorry to hear that. I think at one time when I was seeing 40 patients a day, I didn't have that time either. I couldn't give that time to people. Is it your doctor's fault? In a way, yes, because their best interest isn't your best interest. Their best interest is to keep their job, so they are pushed to see as many patients as possible. And 2, they love their money. They love their money so much that they would discount your health. Yeah, but they care. Well, no, they might care, but they care more about them and their pocketbook. Remember, they got loans to pay back. Remember, they bought big houses and big cars, and they got kids they got to send to college, just like everybody else, of course. But they're going to feel empowered that they need me. The 40 people a day need me. And so how can I turn them down? I mean, they need me. I don't need them. Right, doctor? So my last 13 years, I spent in a solo practice, my own business, seeing 10, 15 patients a day. Imagine the amount of time I could spend with them, like I'm spending with you right now. But now I can see 3,000 people at one time. So all of these things I'm telling you right now, I did for the last 13 years. And did that reimburse? Absolutely not. No doctor in their right mind who's seeing 40 patients a day and making $250,000, $300,000 a year is going to start seeing 10 patients a day for $25,000 a year. They aren't going to do it. So these are the conversations you want to have. That's why you just, honestly, do you need that doctor? I mean, what is that doctor worth? Unless you cut your finger off or you need a stitch, is that the doctor you really want to be paying? Is that the one that you're paying $500 a month for insurance for? The cost benefit does not, to me, it doesn't add up in my head. And I was one of those doctors at one time. Oren says, what is the difference between active and stored vitamin D? Active is just that. It's the active form of the vitamin D. It's the one we can use. Stored form of vitamin D doesn't always turn to active. So all of the stored vitamin D that you have sitting in your fat might not be activated. So that's why it's important to know before we just go to taking vitamin D supplements, which is basically a synthetic vitamin D, what are your levels? Just get your levels checked and then you'll know. Okay, Florida, I will watch for it. I will watch for your email. RM says, I have these random episodes, no warning of sudden vomiting on roadside. Doctors have no idea what is causing it. Well, at the moment, I don't know what's causing it either, unless you're driving a really, really old car and you have a leak in the exhaust pipe and you're getting carbon monoxide poisoning. I don't know. Christine, I think that you should see the doctor of your choice, whether it be a psychiatrist or gynecologist or neurologist or whatever the ologist is. Whatever feels good to you, I'm not going to make that decision for you. But thank you for your questions. Yeah, right, Floyd. There's no, a patient cured is a patient lost. There's so many, Floyd, there's so many patients out there. Doctors don't worry about a lack of patients unless they're in, practice like mine. They're going to go to the big box doctors and be treated like a big box patient, and they don't care. And so if you walk out, do you think that hurts the doctor? No. It might, in my place where I'm only seeing 10 or 15 a day, I might go, hey, Denise, what do you think I did to make that person? Oh, they called and they just said that they wanted to go closer to home and they're driving an hour to come see you. I go, oh, why didn't they just say that? No. But do you think that the big box patients care about what their big box doctors think? No. And vice versa. Future Proof says, my girlfriend has a sore throat. What should she take? I don't know. I don't know what's causing her sore throat. But for soothing, you can put some salt in a glass of water and gargle. But maybe see the doctor. Truth Seeker says, my spouse's doc won't order a fasting insulin. He refuses. You can order it yourself online. If you can't order it, I can order it for you, but you can order it online. I bet it costs $15-20 to order a fasting insulin level and go, once you order it online, I can order it, but you could go to Life Extension Labs, you can go to Ulta Labs, you can go to all these. It's just that I get a little bit of a discount. And sometimes Life Extension Labs will do a 25% discount, but it's not all year long. Ownyourlabs.com, you can order your own labs. So instead of being frustrated, just go do it yourself. Is it worth $20 to you? Just don't buy a Starbucks coffee one day a week. Dragon Belly says, suggestions please for a 25-year-old male with motor neuron disease. He's had it since 2020. What is the cause of motor neuron disease? Is it iron overload? Has the iron been looked into? Is the copper been looked into? Has vitamin D and vitamin A been looked into? How do you rebuild vitamin D stores? Actually, vitamin D, when you're out in the sun, just for the 3 months of the year that, like I'm exposed to, maybe 4 or 5 months, it actually stores up. We can store about 6 months of vitamin D in our body and not have a problem. So that might help Abby as well. Melinda says, after malignant melanoma removal, what's the best way to get vitamin D? Get out in the sun. Eat sardines. God bless you too, Geneva. I appreciate it. Yeah, maybe you got some sort of a motion sickness, RM. I don't know. But 3 times in the last week, maybe you're coming down with a little virus and the motion of the car is making you sick to your stomach. I'm not sure. But if it's only a week, just give it some time. Maybe it'll resolve. I shall check cardio's resume report and we'll come back to you as soon. Thank you for helping and making aware some people that all doctors don't have moral ethics. Well, not all people have moral ethics in general, but if you're thinking that all doctors have moral ethics, you're wrong. We're all human, we're all sinners, and no one is perfect, and that includes doctors. Oh, Stan, how do I go about finding a good primary? Well, I don't know what you're looking for in a good, like what constitutes good primary doctor. I don't know. Interview them. You go in and you see, I would ask around first. I would look at their profiles online. Sweet Tooth says, is it healthy to eat 2 whole eggs per day for breakfast? You probably should be eating 6 whole eggs for breakfast, Sweet Tooth, and get rid of all of your sweet tooth things that you're consuming that is causing your PCOS. Linda says, LOL, Starbucks, $20 per 1 day a week. Yeah, I've never been there. An hour away, I have been there. Still don't trust this unless it's totally safe. Trust this as in what? Linda says, is RM anxious or pregnant? That's a possibility, right, Linda? Good point. RM says, I'm not pregnant. Okay, well, that answers that one. Anxious? Could be. Nervous about taking tests for the phlebotomy certification? Could be. Stan, there's no nutritional value to pancakes, but if you want to eat pancakes, go for it. Neurodoctors have said it's a rare disease and no known cause for it. Okay. Well, maybe you, Dragon Belly, do have a known cause for it, and you need to look into it. Christine, again, if you want to make your own appointment, go make it, okay? See the doctor of your choosing and live with that decision. Linda brings up a good, so a lot of times when we get into a hot shower, we get an instant histamine release, and that histamine can cause nausea and vomiting. Isn't that's crazy you mentioned that. And I mean, that could be what's going on with RM. Maybe it's in the last week, he's in, or she is in an hot car. I mean, it's possible it could be causing a histamine release. I'm not sure. Yeah, fascinating, very fascinating. See, these are the things that I love to talk through with you guys when we're on our consults or just thinking. There might not be a study showing all this, but we got, you walk backwards with these symptoms and go, oh my gosh. And then it's, like Linda says, it's fascinating when your brain starts to light up and your eyeballs get all excited about it. It's just, those are the things that really make me want to do medicine and walk through things with you guys. Yeah, there actually is a test for histamine. Oh, gosh. And it's kind of difficult to get. They're getting antsy. It's almost been 2 hours. So yes, there is a histamine test. There's multiple histamine tests that you can get, and they're hard to get, and you need to find a lab to get them for you. That's what's hard about it. Oh, it's happening once a week for 3 weeks. Again, yeah, the heated seats, that can cause a histamine release. Exactly, Linda. Yeah, exactly. Oh, you studied, okay, so you studied holistic medicine in San Diego. Nice, in the 80s. Good for you. I didn't even know what it was, to be honest. GL, what is causing your high hematocrit and hemoglobin? It needs to be looked into. Instead of just lowering them, why is it that they're high? Are you on steroids? Are you on testosterone replacement? Do you have hemochromatosis? What's your iron? Your iron, ferritin, transferrin, TIBC, saturation? What are those levels? What is your MCV, your MCH, your MCHC? What is your thyroid levels? TSH, free T3, free T4, reverse T3, TG, TPO? What are all of those levels? And then I might be able to help you lower your hemoglobin and hematocrit. Ohio says the best and only time to take a hot shower is at night before bed because it vasodilates you. And I mean, that might work for some people. In other people, it makes them very, very anxious. It increases the sympathetic tone. And because they want to actually do the opposite and vasoconstrict, but vasodilate, vasoconstrict. I actually think that being cold when going to bed is probably the best thing for us as far as sleep is concerned. But Ohio, if a hot shower before bed works for you and you sleep like a baby, go for it. Sleep is important. However you can do it, okay? Okay, Dragon. No meds, possibly hemochromatosis, daughter born with PCV, polycythemia vera. Yeah, I would still get the labs I mentioned. They're, simply just guessing. I'm guessing if she's got polycythemia vera, she's dumping blood. That puts a lot of stress on the bone marrow. You're getting a lot of stem cells being produced, a lot of reticulocytes when we dump blood. Could that trigger cancer? I mean, it's possible. It's possible that it overstresses the bone marrow. I don't know. I'm not a big believer in dumping blood all the time. Maybe if it's once or twice a year, we're okay with it. But yeah, I'm just not. Yeah, Linda, if the warm shower is helping you relax, that's awesome. Spleen with polycythemia vera. All of Linda, there's a lot to look into, right? And we're trying to, sometimes my brain doesn't think of all the possibilities, and I appreciate you guys adding to the conversation. That means a lot. Try Fitness says, hi, just found this live video. You're the type of doctor that I enjoy listening to and learning from. You know what? Thank you for that compliment. I'm the kind of doctor I love learning and listening from too. And I think that's why I use the technique I do, because as I'm talking to you guys, I'm actually learning from me, because I'm walking through things that I may or may not have even thought about on my own. But as I'm talking to you about it, it's like I'm teaching myself. And so I guess I'm the kind of doctor that I want to hear from too. The one that's kind of thinking through things and bouncing things off of people and saying, because you guys aren't dumb. You're more educated, most likely, than a majority of the doctors who have a degree, or a majority of the 3-letter agencies that are out there. I mean, think of that. You need to really put yourself on at a higher level. I don't think we give ourselves enough credit. We really don't. Just because I spent nearly half of my life in education does not make me smart. What I learned in medical school was irrelevant by the time I got to residency. And what I learned in residency was irrelevant by the time I got into practice. And I continued to do continuing medical education that was one-sided. They only give you continuing medical education that teaches you the exact same buffoonery. So we are continuously being bamboozled for 27 years until we stop being bamboozled. At some point, you jump out of the matrix, your eyeballs are opened, and you can't unsee the buffoonery. You cannot unsee it. It is so obvious. You're going, how does anybody else not see this? But again, I've been there, and when you've never not seen it, you just live in bliss. You just don't know. You think everything in your life is real. It is not real, okay? Our reality is skewed in the direction of where whoever wants us to go. It's called, in a nutshell, it's really called radicalization. It's called cognitive dissonance. It's called isolation. It's called an echo chamber. It's called social media. It's called silencing somebody. It's called, it's called entrenched power. It's called enmeshment. It's called so many things. And yes, Linda, we are all learning and unlearning, and that's what it's about. But sometimes we get into a position where when you can't tell somebody to unlearn something, or you can't explain that they should unlearn something, that means they have let's just say we picture a glass full of experiences. We have a glass full of experiences that we have obtained since the day we were born up until where we're at right now. And sometimes our experiences never get dumped out. We continue to fill up that glass, and it stays full of the exact same experiences that we've gained from our previous years in life. You cannot put any new experiences in there. There's no room. So if I told you that cholesterol is not the cause of heart disease, you're not going to get on board with that until you unlearn or dump out some experiences from your glass so you could fit some of my experiences in there. If I tell you to go read this book on other options for coronary artery disease, you're not going to read the book because your mind is already made up. Because you're basing everything that you know right now on your experiences. Dump some out and allow other new experiences to come in. That is how we grow. That is how we become wise, and we use discernment. But if you never dump out any of your old experiences, you will continue to live in a divided, radicalized world that's full of Satan and is ungodly. No, the fact that your mom had her spleen radiated on due to ITP, I mean, that must have been a lot of years ago. Do they do that now? I mean, yes, but yeah, I mean, you need to get genetically tested then, or, you know, if you have, here's the thing, GL, if you have high hemoglobin hematocrit and you know you're at risk of getting a blood clot, check and make sure you don't have factor V or prothrombin mutation. You know, if you travel, wear compression socks, pump your feet a lot if you're traveling, do the things anyway that prevent you from getting blood clots. Yeah, goodbye margarine, that's right. Wish-wash could long-term severe estrogen. Well, you either have estrogen depletion or you don't. I don't know if there's severe or not severe or moderate or mild. Can cause sarcopenia. Our hormones are important for our muscle mass. Yes. Our diet helps with that muscle mass and those hormones. It's important that we eat enough fat and protein for our muscles to grow or to be stabilized. It's important for our bone growth and bone strength, protein, and fat. I have never seen a case of MCAS, but people have told me about it. I've personally not seen it in a diagnosis, but some of my clients have it. So yes, GL, you've been tested for prothrombin mutation and factor V. Is that what you're yesing? I don't know. Okay. Carrie says, what is the difference between Ozempic and Mounjaro in layman terms? Sure. Ozempic and Mounjaro are peptides. Ozempic is only one peptide and Mounjaro is two peptides, two different ones in that medicine. So Ozempic is a GLP-1 and Mounjaro is a GLP-1 and a GIP. And so both of those peptides help to decrease our appetite by telling your brain you're not hungry, by slowing gastric emptying. So when food dumps into your stomach, it sits there longer. So you're not going to be able to hold as much, so you get fuller faster. It supposedly helps to increase insulin secretion, but I don't know of a human study that shows that it increases insulin secretion. What does increase insulin secretion is carbohydrates and of sugars, right? There's been some talk that GLPs increase fat cell hyperplasia, meaning it increases the number or the production of fat cells. You could say, I don't want that, but maybe you do if you only have a few large fat cells. So if you had a lot of smaller fat cells taking up all of the fat that you have, that might be a better thing and to be well distributed instead of all in the liver or your visceral area where most large fat cells are. Geneva says, what's your opinion on ancient grains? I don't care if they're ancient or modern. I don't eat grains and never would. So, okay. I don't, other than that, Carrie, I don't know if I have another explanation as far as Mounjaro. A lot of people get a lot of benefit from weight loss. I mean, 15% compared to 20% with Mounjaro over Ozempic. It just depends. Some people have less side effects because you don't need as much of a dose. Hi, Manu. Okay. All right, you guys, we'll call it quits today, Sunday, the 7th, right? December 7th, here in America, in Iowa it is. And we will be back, Lord willing, next Saturday at 9 a.m. Central. This is your opportunity to ask questions, medical questions, and to simply, learn. Remember, I want to leave you with this. Our health is not just physical. There is a lot of all the questions that we've talked about today are mainly physical stuff. But we have a spiritual side of us and we have an emotional, mental side of us. So mind, body, and spirit. And they all play a part. And I don't want to reduce all of my stuff that I'm sharing with you simply down to if we just fix the physical part of you, that you're going to be better. For instance, RM, saying they've been vomiting once a week for 3 weeks. We could try to dive in and say, is there something physical going on about this? Or is it mental, emotional, or spiritual? The whole mind, body, spirit has to be looked into. And I don't believe a lot of doctors are doing that. And so I'm trying to expand my education and learning. I'm already learning spiritually, but I always shied away from that mental, emotional mix. And I can't do that if I want to be well-rounded. And that's what I want. I want to be well-rounded. And I want to help you guys be well-rounded. I know a lot of physical stuff like the back of my hand. I know a lot about this book, okay? But this is a constant education, and the physical body is a constant education, and mental, emotional is a constant education. And so that's what I want to leave you with, is trying not to reduce everything down to, if I just got rid of my hive by taking some Benadryl, everything is fine, okay? So we can talk more and more about this, but yesterday we had a really good talk because somebody was online and they were talking about their problem with anorexia, and it was good. So if you didn't listen to yesterday's, go back and listen to yesterday's live stream. There's a lot of good points that were made, and I think a lot of people heard, okay? We are live every Saturday and Sunday, 9 a.m. Central on Saturday, 10 a.m. Central on Sunday. If you would like a list of labs sent to you that are pertinent, I don't believe I would have to add active vitamin D because I've been talking about that more. I didn't add in all of the RBC calcium or RBC magnesium, RBC copper, RBC vitamin C. I didn't do any of those things, okay? So if you want those, maybe add those to it, but these labs will give you a good idea, Okay, and then you can always get more later. Yeah, so email me if you want to list the labs. Email me if you want to do a consult. The email address is ironladydoc@aol.com. And Rich, that is a very good question. I think we should probably call it quits today, but if you want to stop back and we can talk about how cortisol and caffeine are related, you might be surprised with the answer. I can maybe even do a reel this week. So you guys have a blessed day, and we will see you back next Saturday, Lord willing. Okay, see ya.